Good day everyone. Let me introduce myself. I'm Razime Arslana from BSN1C Abdella. So before we start, I prepared an icebreaker. So ang title ng icebreaker ko ay Guess the Iconic Filipino Movies, Fill in the Blank Edition. So yung mechanics ng game na to is super easy lamang. May mga sentence doon na blank, tapos huhulaan nyo yung word ng mga iconic lines ng mga Filipino movies. I will be discussing about the nephritis. So, what is nephritis? Nephritis is also known as glomerulonephritis. It refers to inflammation of the kidneys. It can be caused by various factors, including infections, autoimmune disorders, and toxins. It can also affect one or both kidneys and can be acute or chronic. Nephritis can lead to kidney damage, scarring, and impaired kidney function. So, yung nephritis is from the word inflammation is or naga-inflame o yung namamaga yung kidney, nagkakos ito ng various factors which is yung infection ng ating disease, ng ating kidney or nagiging disease na to acute or chronic disease. Other types of nephritis. Number 1, acute glomerulonephritis, which means this form of nephritis can develop suddenly after a severe infection such as strep throat, hepatitis, or HIV. Number 2, lupus nephritis. Lupus is an autoimmune disease, which means that the immune system mistakenly attacks healthy tissues in the body. Number 3, Alport syndrome or hereditary nephritis. This disease can lead to kidney failure as well as vision and hearing problems. Alport syndrome is passed on in the genes and it is usually more severe in men. Number 4, chronic glomerulonephritis. This form of nephritis develops slowly and causes few symptoms in its early stages. As with acute glomerulonephritis, this condition can cause severe kidney damage and kidney failure. It may run in families or develop after sudden disease. Number 5, IgA nephropathy. This is one of the more common forms of nephritis. It develops when IgA antibody deposits build up in the kidneys and cause inflammation. Number 6, interstitial nephritis, often developing very rapidly. This form of nephritis usually occurs during to infection or a particular medication. It affects the part of the kidney called the interstitium, which is fluid-filled space. The causative agent for bacteria are Escherichia coli, Staphylococcus aureus, and Streptococcus pneumoniae. Sa viruses, hepatitis B and C, HIV, and cytomegalovirus. Sa fungi naman, Candida and Aspergillus. For the mode of transmission, urinary tract infections or the UTI, bloodstream infection, and direct contact. Pathogenesis, bacterial or viral infection triggers an immune response leading to inflammation and damage to the kidneys. The immune system produces antibodies and active immune cells, such as neutrophils and macrophages, to fight the infection. For the clinical manifestations, there are common symptoms and severe symptoms. For common symptoms, there are hematuria or blood in the urine, proteinuria or excess protein in the urine, oliguria or decreased protein output, edema, swelling of the face, hands, and feet, fatigue, nausea and vomiting, tiredness, cloudy urine, pus in urine, weight gain, mouth ulcers, fever, and rashes. For severe symptoms, there are sepsis or life-threatening infection, the acute kidney injury, sudden loss of kidney function, the chronic kidney disease or long-term kidney damage. For laboratory diagnosis, there are urine tests at yung under ng urine test ay yung urinalysis at saka yung urine culture. Sa blood test naman ay yung complete blood count or yung CBC at yung blood chemistry test. Sa imaging test naman ay yung ultrasound at saka yung CT scan or yung MRI. For the treatment naman, anti-inflammatory medications, dietary changes to limit consumption of salt, potassium, and protein, reduce fluid intake, medications to control high blood pressure, antibiotic treatment for a related infection. So lastly, prevention. Although it is not always possible to prevent nephritis, certain lifestyle practices can reduce the risk for many people. The practices include the practicing good hygiene, getting vaccinated against diseases such as hepatitis B and C, maintaining a healthy weight, quitting smoking, keeping blood pressure and blood sugar within healthy limits, exercising regularly.